Welcome, everyone.
My name is Lillian Mehran. I am the Senior Consultant for Education and Outreach for End of Life Choices New York. End of Life Choices New York is a nonprofit organization with a mission to improve end-of-life care, expand end-of-life options, and promote healthcare equity at the end of life. We believe all New Yorkers should have the right to a peaceful death and to receive end-of-life care in alignment with their wishes and their values. Before moving forward, let's go over some logistics. As you can see, we have set this up to be in meeting style since this is the perfect size group for discussion and interaction. There will be an interactive component later on, and it is entirely up to you whether you wish to turn your video on. We encourage you to do so if you're able and comfortable. I ask that you please stay muted until the interactive component in Q&A, just to make sure that we can hear our presenter. We are recording, but I do want to note that we want you to be able to speak freely when we get to the interactive component. So I'm going to be pausing the recording for that, and then we'll bring it back for the Q&A afterwards in the rest of the presentation. So we're not going to record the interactive component later on because we want you to be able to speak freely, but for the Q&A, we'll record it because often very helpful information comes up during that. But there will be a way for you to ask questions more anonymously, and I'll go over that when the time comes, so don't worry about remembering all that now. Again, this is the second webinar in our End of Life Equity series, and the purpose of this series is to explore the needs and experiences of a variety of New York communities and strategies to advocate and support these communities in planning for and navigating the end of life. This series is made possible through a grant from the Foley Hoag Foundation. The foundation's mission is to support programs addressing inequality in its various forms, including racial, ethnic, gender, and wealth disparities. Continuing education credits for licensed New York social workers are available for this webinar, and we're able to offer that to you through support from ELDR, E-L-D-R, ELDR. ELDR is on a mission to empower and equip people to conclude life smoothly and be remembered well. Elders help you feel the peace and confidence that come from completing your comprehensive plan, and we will be sharing information about how to obtain a certificate of attendance, which is open to everyone at the end of the meeting today. So without further ado, it's my pleasure to introduce our presenter for today. I'm going to tell you a little bit about her. Carrie Chan is a multilingual cultural sensitivity liaison at MJHS Hospice and Palliative Care. She's fluent in English, Mandarin, and Cantonese. For her, hospice care is a calling. Carrie has spent more than 13 years supporting MJHS patients who are receiving end-of-life care, as well as addressing the needs of their loved ones. Throughout her tenure with the not-for-profit, Carrie has had the privilege of visiting with thousands of patients wherever they live, whether at home or in a nursing home, assisted living facility, or hospital. She first came to MJHS as a hospice volunteer in the bereavement department, and then was hired as a psychosocial counselor before becoming an account manager in the Hospice Access Center. Committed to quality end-of-life care that's provided with compassion, dignity, and respect, community and national organizations often turn to Carrie, like we did, for her expertise, as well as to help demystify hospice care. In 2016, she joined the roster of New York City speakers for the San Francisco-based Chinese American Coalition for Compassionate Care. Carrie became a member of the Chinese Advisory Board with Caring Kind, Alzheimer's Association in 2019. And for the past 5 years, Cornell University's Medical School Community Perspective in Medicine series has invited her to speak with students. When she isn't working or being a guest speaker, you'll find Carrie on the badminton court, rushing down ski slopes, surfing in the wavy ocean, camping, or hiking. That sounds amazing. Carrie, I turn it over to you.
Thank you, Lillian. Thank you. Thanks for having me today. I'm very happy, excited, as well as nervous to be here. I really hope that this could be a very interactive session rather than me alone just talking all the way. So we will have some discussion. I hope you can jump in and let me know if you give me some feedbacks about how you think. Let's do this together. So my name is Carrie Chen. I work with the palliative care program. If you are local, you're probably familiar with the commercial lines that the 4 Brooklyn ladies who started the care 110 years ago, and they eventually paved the way into MJHS health system today. So I hope to start our talk with a little real life stories so we can explain this topic together. Let's meet Mr. Feng and his family. With this consent, I'm able to share this picture with you. Mr. Feng chose the home hospice program when he just turned 60 years old. He looked much youthful than his real age when the first time I saw him. You can't tell that he was having stage 4 lung cancer. He had a beautiful family with a wife and 3 boys. They were 7, 9, and 12 years old. I still remember their names, the cute faces. Yearly, hospice benefit under Medicare for patient it's less than 6 months of life expectancy. Mr. Feng was on our program for nearly 2 years. He surprised us all. He prioritized quality of life. He wanted comfort care, so he decided no more cancer-targeted treatment early on in his disease trajectory. When our hospice program just entered family, it was strange that Mr. Feng was always angry with his little boys. That is so not him. He used to say that he wished he had never given birth to them. He really, that just conflicted with his pleasant nature. He was always welcomes us with a warm smile on, although he's having like physical symptoms, pains and stuff. He always offers water and, offers to take care of us during every visit. He likes to share his life experience. He was born in China. Later on, he fled to Puerto Rico by himself for political reasons, I think. He was alone, but left his family at a young age. He worked there as a construction worker and later on as a chef. He likes to smoke and gamble. For him, the suffering of pain from the disease was never a big concern, specifically for Chinese. Dying is such a taboo topic, but then you don't see that in him. He was very open to discuss any pre-arrangements, prepare for what's next. He was very open to that. He always felt the best time of his life was when the second and the third boys were born. He works as a chef in Chinatown. He was happy and proud to be a father of 3. As the disease progressed, he became withered, very thin and weak, and visibly, just weaker. He would still sneak out of the apartment, still work part-time in Chinatown, just to earn some money to support his family. He knows that the hospice team wouldn't agree to let him work for safety concerns. He often hid it by saying that he was just going out for a walk, but that's for hours. Wife told me in private that he goes out to work, whether he feels is able to do it, and she can't stop him. When he became totally bedbound, hospice team transferred him to a nursing home in Lower Manhattan. I still remember he often just stared at the air conditioner in the nursing home while mumbling that, he wished he could buy one for his boys. Our foundation helped him fulfill that wish. He was especially happy on that day. And the boys were lovely. They were very mature for their ages. Hospice team sent in an art and therapist in hoping to communicate with this young age. Because young children are not so good at expressing their feelings by words, as it is also typical in the Chinese culture. Sometimes coworkers would whisper to me very often after visiting a Chinese immigrant family that, like, Carrie, are those kids adopted? Because you don't see that level of communication between parents and kids. Parents speak limited English, and the kids can also, they are born and grow up here, they can only communicate basic needs in Chinese. I often told them, no, they're not adopted, but then you can still feel that they love and care about each other deeply. Just the verbal communication is missing. I bet just like most of the other Chinese families, they have never said, I love you even once in their life. I fell for that, as suggested by my coworker. Carrie, you should told your mom that you love her. I imagine if I say that to my mom, she will respond like, are you okay? Or thinking that I'm planning to leave her or something. It's just so not a social norm in the culture. Hospice team send in the art therapists to work with the kids. We try to help the kids communicate through making art and thus help them walk through these difficult times. Sometimes art will reflect how they thinking, their deep down thoughts helps them communicate when they're drawing, when they're making something. And they learn to cook with our art and soul therapist. They made cookies together. They made New Year's cards. And the boys wrote down, helping mom, taking care of dad as their New Year's resolution. So Mr. Feng participated in StoryCorps storytelling session as well. He was interviewed by his wife. We recorded both of their voices. The stories were recorded and kept in the National Archive. We tried to leave the legacy behind so that the boys can hear about their father when they grow up. Mr. Feng mentioned it again in the recording that he wishes he had never given birth to the 3 boys. But this time, after knowing him for so long, I realized he didn't finish his sentence. What he really means is that because he couldn't provide for the family the way he wanted to, so, he just wishes he could do more for the boys. But, when it becomes words, it sounds so harsh. I hope the boys will eventually understand it. So he passed away on our program as the disease continued to progress. And this is Mr. Feng. In him, I see the traditional Chinese value and not so traditional side of him. Next is my own family. So when my brother-in-law was diagnosed with cancer in Hong Kong, my husband put us together in a chat group on the phone. It was all the siblings from Orlando, Austin, Hong Kong with our spouses. And then the group name was Brothers Condition. Purposes saying without him. So my brother-in-law is the only one that's left out. All this talk, it was done without him knowing it. So his wife immediately started to tell us his recent test results, how he's doing. Everyone poured in with a lot of questions, concerns, and discussions. Only that he was not aware. All the discussion was behind his back. If you have watched the Hollywood movie Farewell, where I borrowed the titles from, you are no stranger to this decision-making customs in Chinese families. Very often, as a hospice worker, when we receive a new patient assignment in the medical record, it would specify, do not mention hospice with star signs, 1, 2, 3, 4, to draw more attention, making sure people are seeing it. It was always an ethical dilemma. You could imagine. In the US, the doctor would first approach the patient self to inform any medical information versus the norm in China and Taiwan would be to involve the family first. So in our practice, my first encounter with the Chinese patient, I often start very gentle, very carefully with the word, would you tell me about your medical condition? Because I want to assess how much does the patient himself know, right? What would you think about your condition? Would you want to know exactly what is going on, or would you want to make your own decisions, rather your wife or son to make the decisions for you? That gives me a sense of how much the patient knows, and if he wants to be part of his own decision making. You'll be surprised at the answers. Yeah, so of course, in the end, we spilled the news to my brother-in-law eventually, but it was after we made sure that he was mentally ready, and we had more tests, more results to know what is going on. So the attitude towards disclosure of bad news has always been a barrier. Now, after much talk by myself, I'd like to invite you to share yours. Um, what is your impression? Is there any stories between you, your Chinese-speaking patients, and their families you'd like to share? Um, you know, what is your takeaway from all those discussions, all those stories, encounters? I mean, we all learn from each other's stories. I grow with my patients' stories too. Next, let's talk about the boring numbers. Just in case, if anyone is not familiar with the palliative care and hospice care, this is a picture that illustrated really well. As time goes, very often chronic disease continue to progress. Medical focus shift from curative care to palliative care. The patient more than benefit them. So hospice care means doing nothing or giving up on symptom management, on whatever is bothering the patient, maintaining the patient's quality of life. What we've seen really in hospice care is that comfortable patients live longer because they just, have the drive to keep going. But when the symptoms are not bothering them, they'll be able to have fun in life. They'll be able to enjoy their moments. So Medicare regulates hospice benefit as a 6 months of life expectancy, but giving prognosis is not concrete science. Everyone's body reacts differently. Sadly, in New York State, the median stay on hospice care is only 2 weeks, median stay. That ranks as the bottom 3 amongst all 50 states. So in New York City, Asian American accounts for 14% of 8,804,000 of total population. That was from 2021 census data. It is an incredibly diverse community. Chinese is the largest Asian ethnic group, yet only represents 25 rather than the overall US foreign-born population. Roughly about 57% of Chinese immigrants age 5 and over reported limited English proficiencies in 2021, and that number goes up huge as even more as if the age goes up. So commonly, if you see 4 out of 5 grown-up Chinese immigrants, like 4 out of 5 grown-ups speaks very limited English. Besides the language barrier, there is also the cultural beliefs. Some frequent visited issues are the disclosure of bad news. We had a taste of that. As commonly believe how East Asian culture taboos the topic. I've come across some Chinese families. They embrace this difficult talk with open arms. And so, whereas a death at home, that means bad luck. Even if the patient owns the house, very often they believe it brings bad luck and it's going to affect the house later on. They resell, or it's just superstitious beliefs. Death at home was never a popular trend ever in the Chinese-speaking community, no matter if they own the house or if it's a rental. If it's a rental house, that just adds on to the stress. So, when it comes to that, we had to be very creative with each and every case. either transfer the patient to the nursing home earlier on if insurance allows, or independent living, assisted living, or we even assist them in applying for senior housing, city Section A. That's part of the social worker's job in addressing those issues together with the family. So we've done that before. Or sometimes when it comes to last days, IPU placement is possible. I wouldn't say it's a guarantee because very often that depends on acute symptoms at actively dying and so on. So it's often a struggle. When we deal with parents at end of life, filial piety plays a role. It just complicates the decision making. I've heard a patient's son telling me that I cannot decide an end of life decision for my mom, even if I think she needs a DNR. That's bad for her. But all the uncles will be pointing fingers at me and yelling to my face. I think it is the best practice to discuss advance directives early on, but it's not easy. And it's called having difficult conversation for a reason, right? I'd like to offer you a tool. It's called Heart-to-Heart Café workshop. And this picture gives you a sense what's it like in action. We do this heart-to-heart cafes in libraries, in senior centers, nursing homes, and etc. We've been doing it online ever since COVID hits. So the car was designed by Chinese American Coalition for Compassionate Care. They're based in San Francisco, but they are all over the places in China, Wuhan, Malaysia, in Texas, Austin, in New York. Across different time zones, we'll be able to find a time like join everyone together online. That's how we do it. When we're doing it in real life, we often prepare a little tea, a little snacks, refreshment while, talk freely about this taboo topic. So the CACCC, they runs the Heart-to-Heart Cafe online on a monthly basis. The language offered in Mandarin, Cantonese, as well as English. So if anyone is interested, I'll send the link after this. I can explain how it works in a boring way, but I'd like to offer you, let's give it a try. Let's try the game so that you can experience it in person. Let's get started. Yeah, I think the best way to get started is not quit talking, then let's do it. This is how the cards looks like. It's end-of-life options printed on a deck of poker cards. This started from Go Wish cards, and then we add CACCC, the agency added more options, and combine it with the poker cards because a lot of the Chinese loves to gamble, and card game, this is the best way to just engage them. Different suits represents different categories. So it addresses spiritual needs, legal and financial needs, social needs, as well as the physical needs. Now I hope you can take out the pen. I'm gonna display each category on the screen and you pick your top 3 choices. What interests you the most? What matters to you? You can write it down. Let's imagine now I'm very sick at home. I'm feeling weak. What do I need to take care of myself? Let's start from the legal and financial concerns. So from Ace to K represents different wishes. I want my finance to be in order, of course. I want to plan my funeral. Some of the popular ones are I do or do not want to die at home. I want to take care of unfinished business. If I'm going to die, I do not want to be kept alive by machines. So that one got picked a lot. I want to participate in my medical decision. Some people can write it down as I don't want to participate in my medical decision. You can tailor this to your needs, however, what matters to you. I want to, or I don't want to, or I want somebody else to plan for my funeral. I don't want to put my body in the refrigerator until 8 hours after I die. We receive that sometimes it's a concrete request from the family or the patient if they very often when they if they play practice Buddhism. I'll give you 2 minutes to finish reading and pick one from this list. This represents more concrete needs. So let's move on. This represents physical concerns, which is vital for a lot of the patients. Things like, I don't want to suffer. I want to be kept clean and comfortable. I want my favorite food. Oh, yeah. I want to know what's going on, what's going to happen next. I don't want to suffer from shortness of breath. I want to stay alert before I die. I want to have friendly doctors and nurses I can trust. I want a quiet and a pleasant surroundings. I like a room with windows. The next slides represents social concerns. This one is big for a lot of the families. I don't want to be a burden to my family. I want my family to be emotionally ready for my death. I want my family to respect my wishes. I've met one family in a community. It's like the patient saying DNR, DNI, DN everything. Turn around, the wife was saying, "Can you cancel those paperworks? I want him to be resuscitated." So you really come across all kinds of circumstances. Okay, the next one is I want my family to know what dying means to me. So that gives a meaning to what's going on, what happens. And it means differently in terms of one's backgrounds, culture, religion. I wish to be remembered as I don't want to die alone. I want my family and friends to stay with me. I want my family to get along in that after I left. I don't want anyone to have any arguments around me. I want someone to hug me. I want my family to remember the happy times. I want a chance to say, thank you, I love you, I'm sorry, and goodbye. This one was huge among Chinese communities because Verbalizing it, it's so difficult. It's very rare to hear "I love you" from first generation, just Chinese speaking community. The next slide represents spiritual concerns. I want to maintain my dignity. That would be my pick. I want to talk with someone about my spiritual needs. I want to talk about what I'm afraid of. I want to talk about what I've done in my life. Like Mr. Fong, whenever he started to talk about his life in Puerto Rico as a chef or, in the kitchen in Chinatown, you can see his eyes started to sparkling, like the spirit just sparkles right on. He could forget that he's sick. He could just go into his mind and start a whole hour conversation. It's easy for him. I want someone to pray with me. I want someone to pray or chant after I die. I have a religious object next to me. So please conduct only this religious rituals after my death. After I die, don't touch my body for a certain number of hours. Buddhist practitioners, they request that often. Don't cry around me while I'm dying after I'm gone. I don't want to. I want to be free from anxiety. I want to die without regret. I want to listen to the music I like. Next, I would like to introduce to you the researches has been done amongst Chinese-speaking community and what their most preferred heart-to-heart cards. Most picked is 10 of diamond. Over a quarter of participants chose this card is I do not want to be kept alive by machines. The next one picked is the Ace of Clubs, over 1/5. I don't want to burden my family. Number third is a little less than 20% that I do not want to suffer. The next two are our group favorite, that is die without regret, and I want to maintain my dignity. I think this choice of cards also reflects culture, reflects traditions. If you're in the medical field, I think you're no strange to the 911 and resuscitation process. Says I don't want to be kept alive by machines, but even that wish, you would have to put it down on the legal documents before it's happening, because when 911 comes in the household, they are mandatory to resuscitate and to intubate and connect the patient to a ventilator, to a machine. So that wish is easier said than done. Number two is no surprise to a Chinese immigrant family. I don't want to burden my family. That's a lot of the most important wishes for Chinese parents. And of course, I don't want to suffer. Physical comfort is important, especially when it comes to end-of-life issues. Last but not least, I'd like to introduce a video to you. It's a short video. Here we go.
Marker. I feel that, talking about the end of the life actually is very normal.
You know, she mentioned that she wanted to donate her body to science, but we've never actually sit down and talked about her priorities. What are the most important things that she wants at her end of life? Hi, Mom.
Hi.
What's your most important card?
I don't want to suffer. If I have to go, I want to go peacefully. Yeah, I don't want to have any tubes here and there, you know, all kind of stuff. No, I don't want it.
I thought that my mom's most important card is I don't want to be a burden on my family.
But I told her several times, wherever you have to go, you just go. Don't worry about me. I have a volunteer organization to work with, so I can go there every day. I help people and I talk to people. I'm very happy.
It makes me feel like my mother's being selfless, that she doesn't want to be a burden on my new nuclear family with my husband and my daughters.
You know, I hope that, you know, I can somebody and pray for me when I die. Yeah.
My mom is a very devout Buddhist, and one of the important things when somebody passes is that you're supposed to chant for 8 hours afterwards.
Right. I want to have a chance to say thank you, I love you, I'm sorry that before I die. Yeah, I want to say, you know, thank you, I love you, and I'm sorry to everybody.
I feel very grateful for this opportunity. You really should do it. It's not a painful experience. It's not all painful. It's a good time to also reflect about the happy things and maybe discuss things that weren't clear in the past. When Dad was sick, my mom stayed there with him the entire time, 24/7. We would tease them that they were saying romantic things to each other and whatnot. But I think, you know, knowing my parents, that was when they, you know, spoke what was in their hearts to each other and talked about, you know, their lives together and things like that.
My husband stayed there a very long time. I just try my best to keep him company every day, 24 hours. And you know, most of the time, I would I told him, honey, thank you very much for providing me such a good life and have a good daughter. I know you have a good heart. Yeah, Mama love you and Mama trust you. Okay, whatever Mommy did wrong, please forgive me.
Of course.
Thank you. Mommy love you.
I love you.
Thank you. Thank you for being such a wonderful daughter.
No matter how many times I watch this video, always get me emotional. Yep, so that sums up about today. You know, we discussed Chinese immigrant struggles in end-of-life care, but after 13 years of practice, I felt that there are more things in common in between cultures than differences are there. There are Jewish patients, Spanish-speaking patients who don't want to know about their own disease, about their own diagnosis, and there are Mr. Feng that he was totally comfortable talking about death and dying, making his own funeral arrangements even more comfortable than me. So that's all my sharing today. I hope you like it. I appreciate this opportunity to be here and talk to you all. We learn from each other's stories, don't we? Here's my contact.
Thank you so much, Carrie. Carrie, one question I had for you, and I'll make sure also that we share the link to the Heart-to-Heart page that you mentioned, the website. I was wondering, you know, there may be some folks who are here with us today who would be interested in hosting or facilitating one of these cafes. And would you be able to talk a little bit about how to even get something like that started? Who would they contact? How would that work?
That'd be great. That'd be great. Yep. So this CACCC, Chinese American Coalition of Compassionate Care, they have trained facilitators. We can either do it offline in the library or their center, or we can host it online. So what you will do is that I'll share the contact. You can email either me or CACCC, the office, and they can make it happen. We can make arrangements. We can send in facilitators, or we can train you to be the facilitator if it's a more close family or close friends group. And you don't want any outsiders to be in the same group chat. Yep. So that's easy, and we can set it up. I'm gonna share more upcoming CACCC Heart-to-Heart Café workshops as well, just to see if you're interested, and if you have family and friends and professional healthcare worker that be interested in part of it. It's just always there.